I'm Dr. Hameed. I'm an interventional pain physician at Optum. I was drawn to medicine for quite a while. I was always interested in science, and at an early age, I did work at a lab in high school. So I always knew I wanted to do a specialty where I'd be working with my hands and where I'd be procedure driven. However, I also really enjoyed the physiology behind anesthesia. Anything can be treated essentially from head to toe. I treat headaches with various injections. There are multiple joints that I can treat as well. That includes the shoulders, the elbow, the knees, and all the way down to the foot as well as the hip. And I do treat a lot of back pain. I like to be very multimodal in the way I treat patients. Typically, the first visit is a thorough consultation evaluation. After that, we come up with a plan that includes likely physical therapy, use of various medications, and use of lifestyle modification. Alternatively, I also offer several minimally invasive interventional procedures with minimal to no recovery that will then help patients deal with their pain in such a way that it pretty much has diminished or resolved. I, in fact, had a patient who was a dentist and she had her own practice, very young female who was suffering from debilitating neck pain. She was at the point of almost closing her practice down. A few minimally invasive, very quick procedures, I was able to establish her range of motion and limit her pain. And she is back to working on her own and thriving in her livelihood. I really do try to treat my patients like my own family. I want to come up with a specific plan with compassion, with understanding. I'm very grateful for these patients for trusting me with their lives and their care. What I enjoy most about being part of Optum's multi-specialty care is the back and forth and the established care I'm able to provide to my patients. So I am able to contact a dermatologist, a cardiologist, a vascular specialist, a rheumatologist if my patient's symptoms are in fact multifactorial, and we're able to provide the designated care all encompassing in one specific location. I love the outdoors. Being in the Northeast, we see all 4 seasons. I do love a good snowfall or even going out for a hike. We're very lucky being part of Long Island to have a lot of beaches, as well as New York City being very close. So I'm very lucky to have exposure and many locations at my disposal very closely. I'm Dr. Hameed. I'm an interventional pain physician at Optum.